Hello and welcome back to Conceive. In our last episode, we had with us Dr. Anita, who was explaining to us with regard to PCOS, the Polycystic Ovarian Syndrome. Dr. Anita is an authority in PCOS and she runs an exclusive clinic with a specialty for PCOS alone. She did explain to us in detail with regard to what PCOS is, the symptoms, how prevalent it is, and how do we manage it. And she also promised us that in the next episode, she would inform us in detail how to manage PCOS with diet alone. Diet and exercise, but this episode with diet. Welcome, Dr. Anita. We are all anxiously waiting for this episode wherein you could help us with the diet that we need to follow for PCOS.
PCOS or polycystic ovarian disease, as we discussed in our last episode, it's a fairly common condition due to the hormonal imbalance, and as I explained, it's not really a disease and it needs to tackled by changes in the lifestyle rather than just bombard with medicines or visit doctors. And it is important that you need a multidisciplinary approach. You need a dietitian, you need an exercise specialist, and you need a counselor along with a physician or the clinician or the gynecologist, whoever is dealing with PCOS. So, diet, everyone is interested in diet, right? Yeah. And people think that there is a diet for PCOS. Sorry, but there is no magic. Like everything else in life, there is no magic. But you could change a lot of things which probably you are doing in the wrong way when it comes to diet. When you eat, how you eat, what you eat, how you cook it, what ingredients you use it, where you buy it, a lot of things. And it's not just a PCO diet, it's just a healthy diet. So, if you are not a PCO, you can still listen to it, you could still change, because it's nice to be healthy, it's nice to be healthy and active. So, we will discuss in detail about how you can practically change your diet.
Doctor, what is the most important aspect of the diet?
When it comes to PCOS, carbohydrate. So, the way we utilize carbohydrate is the most important aspect, and so is you need to know about glycemic index, high glycemic index and low glycemic index foods.
What is glycemic index?
We hear a lot about glycemic index these days. It is nothing but an index to understand how the food is utilized, especially carbohydrate. See, the sugar levels in our body will go up after intake of food,
right,
with the carbohydrate. So, this index, the glycemic index, just gives you an idea how the sugar level is going up and when it is going up. So, to put it in simple terms, you need to understand what it is. Like if you eat a particular food, if the sugar level is high immediately, within 15 minutes, half an hour, it's very high. That means that particular food is having high glycemic index.
Okay.
That is all you need to understand. There's nothing else. If you have certain food like pasta or boiled rice, your sugar will go up slowly. It doesn't rise very quickly, but if you eat something like a white bread, your sugar level go up quickly. Especially any food containing refined sugar, the sugar level will go up easily, and easily digestible food, the sugar level goes up very high. So, what happens is that you have foods which have high glycemic index, you have foods with low glycemic index. In patients who have PCOS, it is better that you have food with a low glycemic index. That means you do not want your sugar level to go up very soon. You want it to go up slowly and stay for longer period.
Okay.
Because you know that the insulin level I explained last time is high in PCO patient. So, you do not want your insulin to go higher because you already have a high insulin level by taking food which have high glycemic index. So, the main reason why it is advised is that you want your insulin level to be more controlled and not too high.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. Southend Fertility and IVF.
This program is brought to you by Southend Fertility and IVF.
What are the other things that need to be taken care in the diet?
There are quite a lot of things, starting from the breakfast. Everything starts with breakfast. You need to have a proper breakfast, that too quite early. You know, the advice is that you take something, at least if not the full breakfast, some calorie intake should be happening within half an hour after you wake up. Because the basal metabolic rate of the body, you know, that is what drives your energy, that needs to start early. So, only if you take a proper breakfast, your basal metabolic rate is regulated, which is a major issue in PCOS. So, start having a proper breakfast. You need to have a healthy breakfast, obviously, and the intake of food should be more regular. You know, it should not be that, you know, you have a long gap in between and that you are starving and you go, you know, really tired before you go for it. Should be regular. So, for PCO it's better that you have something to eat at least 3 to 4 hours interval. You need to add some form of protein in every meal that you take. It's a problem with that a high carbohydrate that PCOS is suffering. So, you need to add proteins and a little bit of oil or fatty acids in every meal that you take. You need to try and increase the amount of fiber by adding foodstuffs like whole grains, lots of vegetables and fresh fruits. It is a little bit difficult in the current scenario because the easily available foods are processed foods, but it is quite important for this condition that you have to try and prepare from raw material instead of taking processed food. Processed foods are quite harmful for not just PCOS but for everyone. And when you choose the type of oils, you want to use unsaturated and avoid saturated fats. So, if you want to eat non-vegetarian foods, you have to try and have fish, lean meats, and try to choose lean cuts of red meat. Hydration, and as you know, drinking water is very important. You have to keep yourself hydrated. You need to drink at least 10 to 12 glasses of water every day. So, it is like around 3 to 4 liters on and off. The sugar intake should be minimal because, you know, the processed sugar is quite bad for PCOS. So, you have to try and avoid sweets. the salt intake does have some importance, because the long term side effects of PCOS is generally due to cardiovascular diseases. So, they include having hypertension, diabetes and cardiovascular diseases. It is always better to limit the intake of salt. Variety is the key. So, you need to eat different varieties of food so that you get all the nutrition. So, it is better to combine different types of veggies and different types of salads, some food with source of protein and the food with carbohydrate. So, you need to choose something with a low glycemic index, as I explained earlier. So, you have to try and take a variety of food to get your nutritional supplement. Now, when you think about the method of cooking, we all like fried food. Everyone likes fried food, but the fried food can be quite harmful for you. So, you have to try and use different methods of cooking, like either grilling, boiling, steaming, etc. And these type of cooking would actually help in preserving the nutrition, and also it will avoid the excessive intake of fats. Having a high cholesterol, dyslipidemia are a high risk among PCOS patients.
What are the foodstuffs or things that we should avoid doing?
When you think about the foods to avoid, I think you have to stop going to the bakery. It's easy to be said than done, I know that. The children like cookies, children like candies, children like all sorts of unhealthy food. You have to avoid or at least restrict taking foods from bakery, like cakes, pastries, cookies, biscuits, ice creams. So, these foods generally have a very high content of processed sugar and saturated fats. So, you have to try, and it's better not to take, but if you feel that it is impossible, you have to minimize the intake of these foods. Even for children, people think that children can eat sweets. No, that's wrong. It's quite bad for them. The incidence of diabetes is very high among children nowadays because of the intake of fast foods and sweet items like these.
How about the soft drinks which are available, the health drinks and the soft drinks which they are available?
How can I ever forget that? They are the worst, really. Soft drinks, sugary drinks, sports drinks, they're all quite bad.
All the carbonated ones?
Yes, quite bad.
Okay. So, now we have a big list of what not to eat. Could you also advise us, like, what are the foods that are good for us?
You have to include a variety, as I explained earlier, with fresh fruits, veggies, whole grains and unsaturated fats. So, I will give you a list of things which are quite good for PCOS. Among veggies, green leafy veggies, cucumber family vegetables are quite good. Pulses, lentils and different types of beans not only just provide proteins, they are quite good for PCOS. So, ideally a polycystic ovarian syndrome patient should take a lot of pulses instead of taking a lot of non-vegetarian food. Whole grains like wheat, boiled rice, millet, oats should be included in the diet. Good oils include olive oil, corn oil and canola oil. The best thing is to take a lot of fresh fruits. So, ideally you should have a good mix of about all these things that I have mentioned and take them in small portions and in regular intervals.
Southend Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, Southend has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of Southend. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. South End Fertility and IVF.
This program is brought to you by South End Fertility and IVF.
Now that you've mentioned about all the food that we should take and which we should avoid, are there any natural remedies for PCOS that we?
There are quite a lot of herbs which are available. Basically, I think most of the herbs, I cannot say that scientifically I know Ayurveda fully, but I do find that there are a lot of studies coming up proving that the herbs used in Ayurveda are quite effective. I think the mechanism of action is by reducing the insulin resistance, which is one of key factor in PCOS. Neem, tulsi, and a lot of other herbs are used in Ayurvedic medicine. Especially in regularizing period, I think many of the Ayurvedic medicines are quite effective in PCOS patients.
So some of the natural things, as you mentioned, like the basil leaf and fenugreek, all these things too would be
Yeah,
very
they
helpful,
are
right?
usually used in diabetic patients as well.
Right.
But they do seem to be helpful by reducing the insulin resistance.
Okay. Doctor, as you rightly said earlier, it's easier said than done. All the tips that you've given about the food habits that we should follow, the ones that we shouldn't. But on a practical basis, for the help of our viewers, could you give us certain tips on how we could go about this practically? The reason is, as you know, in most of the houses, we both, husbands and wives, go for work. And the time is very short, and that's one of the reasons why the business is flourishing with the bakeries and the fast food. Could you give us some of the tips? Well, you two are a mother at home, and you two have practically, you do follow how this should go on. Could you give us some tips on how we, the lay people, could take on to your advice on a practical basis for coming out with the right type of cooking and the right type of food that we need to eat?
Well, as you rightly said, it is quite tough for couples these days, because most of the households, the wife is also working, and it is quite difficult to have help from elderly mothers or in-laws, because now it's more of a nuclear family system.
Right.
And you have children going to school early. It's difficult to even have a breakfast for them,
right.
let alone have all
Proper
variety
meal, yeah,
of
correct.
balanced food and all that. So let me think what are the things you can do. I feel that looking back at my life, as you said, like I've been working throughout. I had kids, they've all gone away now, grown and away. But when we look back, I feel that certain things that we did, we managed to do it, could be useful for them as well.
Yes.
Like if you go for shopping, supermarket shopping, try and have a list of things that you want to buy before you go, instead of searching and buying whatever you find. That way, you're going to have a list of healthy stuff. So you're not going to buy that white bread or white rice, but you're going to have a whole grain. So you have healthy stuff written in your list already. So you're not going to buy anything from the sweet side, the bakery side.
Yeah, usually
So
you get tempted.
the best,
seeing
yeah,
all these
you get
things and-
tempted. One tip is that you eat and go to the shops.
Okay.
Because they say that if you're hungry, you tend to buy a lot of sugary stuff.
Oh, that's a good
So
tip.
you can have something to eat and then go to the shop for shopping. For example, if you're buying 4 liters of oil, I'm just giving you an example, for your family per month, what you can do is you can try and cut it down to 1 liter. So you don't buy more. So
And
you're
you
going to
manage all of it.
automatically use less.
That's brilliant.
So that is one way you can do that, the basic shopping. And then the other thing is to go to that vegetable shopping. You go and buy a lot of green stuff. So when you buy a lot of vegetables and fruits and you have it at home, you will automatically use it.
And
so
don't go to the bakery.
Yes. So buy healthy stuff, you'll automatically use it. That is one way. The other method is to it's quite difficult to say that you don't have a cook, you do everything yourself. It may not be practically possible for everyone, but if possible, cooking yourself might be more healthier, and eating at home more frequently is healthier than eating out. You have to try and minimize eating out as much as possible. It's quite unhealthy because the hotel food, it's always tastier. It has more oil. It's having more fried items. They might even use more chemicals as taste makers. So it's quite unhealthy to have hotel food. So try and eat at home mostly.
And the kind of oils they use.
Yeah,
and all those things would
we can
vary.
use the better quality oils. And if you're using olive oil, there's no point in frying it. It's no good if it's already fried. So you have to try and boil your food or cook your food and then add olive oil instead of frying it in the olive oil. So you have to make small changes like that. The other thing what we used to do is that I still miss it so much. When the kids were small, we used to cook our dinner together, myself, my husband, we are both doctors. Even from a small age, I used to have Priyanka and William to cook along with me.
Okay.
In the evenings, we used to go there by around 7 o'clock. We used to make salads, and so my husband used to cut fruits and the kids used to cut salads. So I made a routine that they do something even from the age, if I remember correctly, they started cooking by the age of 5 or 6. So it's nice to involve the kids.
Not only a family
Yes.
bonding, they begin to enjoy the
So
food they cook. Yeah.
they learn to cook healthy and they actually enjoy.
Exactly.
Otherwise, it's very difficult to make them eat salads.
Exactly.
But when they actually make it,
They feel like eating.
they feel and they become more creative, and it's quite good because I remember they used to mix so many things to make salads. The salads were so tasty. They're not like boring cucumber, tomato salad. We used to have so many stuff in salads with nuts and honey and all different veggies and everything into a salad
And
with fruits.
And the children become more creative
Yeah.
with their. Okay.
So, that is quite nice to involve your kids so that they also learn at home what is healthy eating, and they get involved in cooking and all those
This,
things.
I suppose, not only helps improve the health, even the family bonding it does help a
Definitely,
lot.
that definitely helps. Other than that, cooking tips, I think, another important thing for working women especially, when you're going to the office, you don't get any snacks. You have a tendency to eat fast food as snack or
Right.
take food in the
In
office.
between, right.
So what you can do is, you can have small boxes of nuts. Nuts are quite good for PCOS, as we said earlier. Almonds, raisins. You can have a small box in the office instead of taking it daily, or you can take a small pack with you so that
Right.
you can have it as a snack in between, which is healthy and which is going to avoid your outside food intake. So when you're going to the office, you can take some fruits as snacks so that you can avoid taking food in between outside. The other thing is that we are partying all the time nowadays. Party every other day, some other party. I think we have to try and avoid the parties which you really don't have to go to, because it's not really good for the kids to be going and eating all this junk stuff and staying up late all this while. And if you do really want to go for the parties, I have a small secret. What you can do is have little food and then go, so you eat less there. Okay, so now we got a lot of tips. What else? Yeah, I'll tell you another thing. It's quite difficult to get the children to eat salads, right? Salads and veggies. I know all the mothers agree with me. Don't tell my kids, but what I used to do is, I used to take them for swimming, or taking for some kind of gym classes or some exercise classes, and when they come back home after swimming, they would be starving. And what I used to do is that I'll make a colorful salad in the fridge and keep before we already went for swimming, keep it on the table nicely, and when these starving kids come back, I used to cook the proper meal. I used to keep it away until these kids finish the salad. So I will not bring the food until these children, they're so hungry that they'll eat the salad. So, that way, they got used to eating salads and they started liking salad. I think they like the salad.
That's an interesting, good tip.
So, you have to use your
imagination
and creativity, and you decorate your food nicely.
You plate it well.
Yeah, plate
with
it
eyes,
nicely.
nose and all
that. So that kids like, they make it green, red. Green
Colorful,
you can use a lot of herbs. You can make carrots and make stuff nice
Vegetables
and beautiful for the kids.
Variety of colors with beetroots and
not for the
carrots.
kids, for the husbands as well. It's not easy to make man eat salad.
Okay.
So there you go. I think, hopefully you've learned something about diets today.
That's wonderful. In fact, this would have helped all of us to make a change in our family diet, which would in turn help not only the health of our children and our husbands, as you say, not just that, even the bonding of the family. And right now, from what you spoke, what I gather is you're bringing back the old culture that we had, which we are missing nowadays.
Old is gold?
Yep. So this is, in fact, this episode would bring us not only about PCOS, but in fact, general health as well as a family bonding, bringing back the culture.
Well, I hope so.
Well, in fact, you did give us a lot of information with regard to not just PCOS, as I'm saying. It's been a lot of wealth of information for many things in our life, a practical life. So, would you like to add anything else to the point of how to help?
I think that's quite a lot of information for one time. I think there are, I would love to talk about physical activities, but we'll do it next time.
Okay, because that too, I suppose the way you are saying it, we will have a lot more to know about that.
To know about physical activities as well.
Okay, wonderful. Thank you, Dr. Anita. As always, we have had a wonderful time. A lot of information, not just with health, but even the family and the life that we need to live. Thank you all for viewing this episode of Conceive.
This program is brought to you by South Infertility and IVF.
South End Fertility and IVF, where hope meets happiness. Established in 2001 and guided by care, ethics and expertise, South End has completed over 10,000 ART cycles. It offers comprehensive infertility treatment for both men and women. Modern facilities and experienced team is the hallmark of South End. The centers are at Vasant Vihar, Gurgaon, Saket, Paschim Bihar and Amritsar. South End Fertility and IVF,